Hello, I'm Priscilla Meehan, Community Relations Manager at Santa Clara off of Lawndale and 45. We have Dr. Erica Giwa here to talk to us about some COVID-related symptoms for expecting mothers. And with fall around the corner, we have many questions on how it'll also affect us with the flu season. So we'd like to welcome Dr. Erica.
Thank you so much, Priscilla. I'm happy to be here to give some tips to all of our expecting moms regarding COVID and flu.
What should a pregnant person's main virus concern this year during the flu or COVID-19 pandemic?
So actually it should be both viruses because both viruses can be pretty dangerous. A pregnant woman has the same likelihood of contracting flu or coronavirus in comparison to any other person. However, a pregnant woman is at increased likelihood to experience complications related to these illnesses. Anyone who's ever been pregnant can remember all the changes that you could see and feel in your body. There are also some changes going on that you can't see and you can't feel. There are changes to your immune system. There's changes to the functionality of your heart and your lungs. These changes make pregnant women more prone to experience severe illness with respect to flu and coronavirus.
Is it safe for those who are pregnant to get the flu vaccine during COVID-19 pandemic?
So yes, it is. It is absolutely safe to get the flu vaccine. The CDC actually recommends that all pregnant women get the flu vaccine regardless of their trimester. So you can get at the beginning of pregnancy, the end of pregnancy, any time in pregnancy, you can get that vaccine. If you're wondering about your family members, should they be vaccinated? The answer is yes. Anyone who is above the age of 6 months and has no other contraindication should absolutely receive the flu vaccine.
Can the flu shot be given during the pregnancy to offer protection for COVID-19?
So unfortunately, no. The flu vaccine does not protect against COVID-19. There's actually no vaccine right now that protects against COVID-19. However, it is still very important to get the flu vaccine because it can reduce your risk of severe illness, hospitalization, and death. So the flu really looks a lot like COVID-19. They have very similar symptoms. Those symptoms are fever, cough, shortness of breath, body aches, and fatigue. If you are experiencing any of these symptoms, it is really important to communicate with your legacy OB-GYN provider immediately so that the course of action can be determined.
Can you talk to us a little bit about the benefits of getting vaccinated during pregnancy?
Vaccination actually protects mom and baby. Babies who are born to mothers who've been vaccinated have been shown to have protection in their bodies for several months following deliveries. Babies can get really sick when they get the flu, and they can't get the flu vaccine until they're 6 months. So it's really important for mom to get that vaccine because when she gets it, she develops what we call antibodies. Antibodies are fighter cells that help us kind of ward off infection. So when mom has those cells in her body, she can pass those to baby through her placenta or through her breast milk if she decides to breastfeed. So this is what reduces the baby's chance of having illness.
During pregnancy, is there any possible way to reduce the risk of getting flu and the coronavirus?
So the good thing is that all the things that we've been doing in the community to flatten the curve for coronavirus will also help reduce flu. So social distancing, wearing your mask when you cannot social distance, washing your hands for at least 20 seconds, increasing sanitation, these are all things that are helpful to reduce the spread of any communicable disease. Mm-hmm. Also, if you know that you're sick or you know that someone else is sick, make sure to stay away from those people until they're well. And so I've mentioned wearing the mask. So I have my little mask here, and I want to take a moment to make sure that we're all wearing it correctly. We're all very, very familiar with this. When you're wearing your mask, you want to make sure that it is covering your mouth and your nose. The tendency when you have the mask on is to think, oh, when I have it on, nobody can hear me, so let me take it down. Don't do this. When you're doing this, you're not providing the protection for those around you that you should. So make sure that it's up over your mouth and your nose. All of these things will help with the spread of coronavirus and flu.
How is Legacy helping pregnant mothers stay healthy and safe during the coronavirus?
So Legacy is offering immunizations at many sites. So if you would like to get a flu vaccine, please give us a call at 832-548-5000. If you have any other concerns, you can also reach out to us at that same number. Additionally, if you are having any symptoms that I mentioned before, fever, shortness of breath, body aches, fatigue, please let your legacy providers know as soon as possible. We are all here to make sure that you, your baby, and your entire family remain as safe as possible during this flu season.
I hope this whole segment on COVID-19 expecting pregnant mothers was helpful. And as always, thank you for watching and goodbye.
Bye-bye.